If you are over 60 and your last blood test scared you, I need you to hear me for the next few minutes, because what I am about to share may be the simplest thing you can do tonight, before you go to sleep, that could change the way your blood sugar behaves for the rest of your life. My name is Dr. Thomas Reynolds. I have spent more than 3 decades sitting across from older adults like you, listening to the quiet worry in their voice when the lab report comes back with a higher A1C than the year before. I have heard the fear that sits behind the words, "Doctor, am I going to lose my independence?" And I have watched again and again how a single ordinary kitchen ingredient, taken in a single spoonful, taken at the right time, taken in the right way, can become a small daily turning point. Today I want to walk you through exactly that. In this video, I am going to tell you the one spoonful that has been studied for glucose response in older adults. I will explain why your blood sugar tends to climb at night, why the timing of this remedy matters more than the remedy itself, why most people accidentally cancel it out within 10 minutes of taking it, and the simple evening routine that turns a spoonful into a habit your grandchildren could follow. I will close with the 7-day framework I share privately with my patients, and what you may actually begin to notice if you do this consistently. Stay with me, because item number 4 is the one most people skip, and it is the reason so many give up before anything changes. Before I tell you what the spoonful is, I would love to know who I am speaking with. If you can, drop a comment below and tell me your age and the country you are watching from. I read those comments personally, and they help me tailor the next videos for you. Now let's begin. 1. The spoonful itself. Raw, unfiltered apple cider. Vinegar. When I say 1 spoon of this before bed, I am talking about 1 tablespoon, around 15 milliliters, of raw, unfiltered apple cider vinegar, the kind that looks cloudy because the live culture of bacteria and enzymes, is still floating inside the bottle. This is not the clear, distilled vinegar you use to clean your kitchen. This is the living kind, and it has been studied for blood sugar support in adults, including older adults, for more than 2 decades. Here is what most people misunderstand. They hear vinegar is vinegar, and they grab the cheapest bottle on the shelf. They miss the entire point. The acetic acid in vinegar is what does the work, but the polyphenols, the trace minerals, and the fermentation byproducts in the unfiltered version appear to support the effect in a softer, more sustained way. In studies where adults consumed a small dose of vinegar before a high carbohydrate meal, post-meal glucose spikes were noticeably smaller, and fasting glucose the next morning trended lower over weeks of consistent use. Nobody is suggesting vinegar replaces your medication. Nobody is suggesting it cures diabetes. What the research trend suggests is that this small food-based habit may help support steadier glucose as part of a broader routine, especially in adults whose numbers are starting to climb but who are not yet on multiple medications. Why does this matter specifically for you and not for a 30-year-old? Because after 60, your pancreas tends to release insulin a beat slower than it used to. Your muscle cells become a little less responsive to that insulin, like a doorbell that still works, but rings more quietly. Your liver releases a small amount of stored sugar into your bloodstream overnight, a process called nocturnal hepatic glucose output, and that release is often larger in older adults than it used to be. A spoonful of apple cider vinegar before bed appears to slow the rate at which carbohydrate from your last meal hits your bloodstream, and it has been studied for its effect on that overnight liver release. Both of those mechanisms matter when your A1C has been inching upward. In plain English, imagine your bloodstream as a city street and glucose as traffic. After a heavy dinner, traffic comes through in a flood. Vinegar at bedtime acts like a traffic signal at the on-ramp, smoothing the flow so the street does not jam up at 2 in the morning. That, in plain English, is what we are hoping to influence. How to do it? Take 1 tablespoon of raw, unfiltered apple cider vinegar. Dilute it in a tall glass of plain water, around 200 to 250 milliliters. Sip it slowly across 10 minutes, around 30 minutes after your dinner. Not at midnight, not first thing when you wake up, but as part of your wind down use. A straw if you have sensitive teeth. because the acid can erode enamel if it pools in your mouth. Brush 30 minutes later, not immediately, so you do not brush the softened enamel away. 2. The water you mix it with matters. This sounds trivial, but it is not. The spoonful only does its work if it is diluted. Straight, undiluted vinegar, dropped straight onto the lining of your stomach at bedtime, can irritate tissues that are already more delicate in older adults. It can cause heartburn. It can wake you up at 2 in the morning for the wrong reasons. An irritated stomach lining is one of the most common reasons people quietly stop a habit that could have helped them. Think of vinegar and water the way you think of medicine and juice for a child. The medicine is potent. The juice carries it gently. You want the gentle version. Use room temperature or slightly warm water. Cold water on a quieter, older stomach can slow digestion just enough to create discomfort. Warm water helps the acetic acid reach the lining of your small intestine, where the slowing of carbohydrate absorption actually happens. Skip the honey, skip the lemon, skip the cayenne. Those are social media additions, not clinical ones. Plain water, apple cider vinegar, 10 minutes of slow sipping. 3. The biggest mistake, taking it right after dinner instead of 30 minutes later. If you remember nothing else from this video, remember the timing. The mechanism I described only works if the vinegar arrives in your upper digestive tract before the carbohydrates from dinner finish arriving there themselves. Take the spoonful within 5 minutes of finishing your meal, and you have missed the window of usefulness. Take it 3 hours later, as you are brushing your teeth, and you have missed a different window. The sweet spot is roughly 20 to 40 minutes after your last bite of food, while you are still awake, while you are dimming the lights, while you are letting the day settle. In real life, here is what that looks like. You finish dinner at 7:15, you wash the dishes, you sit with a cup of tea, or you read a few pages, or you watch the news. Around 7:45, you pour your tall glass of water, you add the tablespoon of apple cider vinegar, you sip it slowly across the kitchen counter, and by 8 o'clock you are ready for the rest of your evening routine. That is the rhythm, that is the habit. 4. The habit most people skip, a 10-minute walk after dinner. I have placed this fourth on purpose, because it is the item that nearly doubles the benefit of the spoonful, and it is the one my patients consistently tell me they did not bother with. A short, easy walk after your evening meal, even 10 minutes, even at a slow pace, even with a cane, even from the living room to the end of the driveway. And back has been associated in research trends with smaller post-meal glucose spikes and steadier overnight readings. Your muscles, while gently moving, pull glucose out of the bloodstream the way a sponge pulls water off a counter. They do not need a heavy workout, they need a quiet, consistent invitation. Picture a window in your living room. After dinner, the curtain is closed and the streetlight is bright. You walk to that window, you walk back to your chair, and somewhere inside your muscles, a small factory opens its doors, takes in glucose, and stores it cleanly. That is the moment, that is the habit. Combine it with the spoonful. And you have given your blood sugar 2 separate, gentle reasons to behave itself overnight. If a walk is not possible tonight because of weather, because of joint pain, because of low balance confidence, do 10 slow chair stands instead. Sit, stand, 10 times with your hands on the armrest for safety. The muscles still wake up. The glucose still gets used. The principle holds. 5. What you ate for dinner quietly decides everything. You can take the spoonful perfectly. You can time it perfectly. You can walk perfectly. And if your dinner was a large bowl of white pasta with garlic bread, a sugary dessert, and a sweet drink, you have undermined the entire evening. The spoonful is a support, not a rescue. It gently smooths what lies underneath. If the underneath is enormous, no spoonful in the world will save you. For the next 7 evenings, while you are testing this routine, try to build your dinner around 3 ideas. A palm-sized portion of protein, 2 generous handfuls of non-starchy vegetables, broccoli, leafy greens, zucchini, green beans, peppers, whatever you enjoy, and a small fist-sized portion of slow carbohydrate sweet potato. Lentils, whole grain rice, oats, barley, not a bottomless plate of bread. The vinegar works beautifully with this composition because acetic acid and fiber together slow the entry of glucose into the blood more reliably than either one alone. Think of them as two gentle hands slowing the same door. 6. The hidden mistake that quietly cancels the routine. This one surprises almost every patient I sit down with. Many people, before bed, with the best intentions, eat a small diabetic-friendly snack, a few biscuits, a piece of fruit, a small bowl of yogurt, on the assumption that it will keep their sugar stable overnight. 4. Many older adults, especially those whose A1C has been climbing, that late bite actually creates the spike the spoonful was trying to prevent. Vinegar does not cancel a fresh carbohydrate load. It only softens what is already in motion. If you are genuinely hungry in the hour before bed, choose something that contains almost no carbohydrate, a few almonds, a small piece of cheese, a boiled egg. These give the body something to work on without inviting another glucose wave. The spoonful of vinegar, taken alongside one of these, performs at its best. Before the final piece, a quick reminder. If this video has been useful to you, a simple like and a subscribe go a long way toward helping other older adults find it too. The YouTube algorithm is not very smart, but it is faithful to engagement, and your small tap signals that this kind of careful, calm, evidence-aware health information matters more than the louder, more dramatic channels out there. 7. The 7-day framework and what you may begin to notice. I want to be careful here, because I do not want to make promises that biology cannot keep for everybody. So let me give you the framework and let your own experience be the teacher. Evening 1 through 7, the same routine, a balanced dinner, a 10-minute walk or 10 chair stands. 20 to 40 minutes later, 1 tablespoon of raw, unfiltered apple cider vinegar in a tall glass of room temperature water, sipped slowly. No late evening snack loaded with sugar or starch. Then rest. In the research trends I have followed, some adults begin to notice smaller morning glucose readings within the first week. Some notice fewer late-night sweats, fewer wake-ups with a pounding heart, fewer mornings where they feel foggy and heavy. Some do not notice anything for 2 or 3 weeks, and that is fine, because the A1C number itself moves slowly. A1C reflects an average of the last roughly 3 months of blood sugar. A week of supportive habits will not rewrite that average overnight. What it does is begin the trend in the right direction. Consistency is what turns a trend into a number your doctor is pleased to see at your next visit. Which brings me to something I want to say very directly. I am not your physician. I am a voice on a screen, sharing patterns I have seen in clinical practice and in published research. If you are already on insulin, on a sulfonylurea such as glipizide or glyburide, on a blood thinner such as warfarin, or if you have been told you have kidney disease, gastroparesis, or significant reflux, please speak with your own doctor before starting this routine. Vinegar can lower glucose enough to interact with certain medications, and in rare cases that interaction has produced hypoglycemia. Never stop a medication your doctor has prescribed in order to try a spoonful of anything you saw on the internet that includes this video. Bring this video to your next appointment if it helps and decide together. A closing word from one human to another. I have spent my career at the bedside, in the clinic, and now, apparently, in your living room, speaking into a small screen while you sit in your kitchen deciding whether to try what I have described. I take that responsibility seriously. I do not believe in miracle spoonfuls. I believe in small, dignified, repeatable acts of self-care that respect the body you have lived in for many decades and ask it gently to do a little better tomorrow than it did today. If your A1C has been climbing, you are not failing. Your physiology is responding to age, to years of meals, to stress, to sleep, to movement patterns, all of it. That response is real and it can be softened. A single tablespoon of raw, unfiltered apple cider vinegar, diluted in water, taken at the right time, supported by a short Walk, supported by a kind dinner, supported by a calm evening, is not a hero. It is a small, faithful friend who shows up every night and quietly does its job. That multiplied by 7 evenings, multiplied by 70, multiplied by the rest of a healthy, independent life, is how ordinary people get extraordinary results. Try it for 7 nights. Pay attention to how you feel in the morning. Bring it to your doctor. And if it helps, leave a comment below telling me what you noticed. I read every one. Thank you for spending this time with me. I will see you in the next video.